clean over gloves, putting away the inventory, and now he knows that he has what he needs in order to thoroughly get through setup and breakdown of his unit, as well as whatever he needs for patient treatment supplies when treating your patient. So new overgloves, supplies are being put away. So here, overgloves are going into this cabinet. The sterile 4x4s that he needs will be going into that sterile bin and the other cabinet. And then he's going to discard the paper towel and get into utility gloves. So remember, utility gloves under the sink area. He's going to find the size that works for him, and if they're not right under that cabinet, you need to look around the clinic or in the drawers under the ultrasonics in Central Supply.
You said discard the paper, where is it?
The paper towel that was on the counter that he put the inventory on. Okay. So that paper towel was discarded. He found the proper size utility gloves. Remember, these are your heavy-duty nitrile cleaning gloves. He's washing them 220 consecutive wash rinses. He's going to wipe his hands from fingertips to wrist and wipe up the sink area. Once he completes that, he is going to assess the Birex in the bottle at the sink to see if he has enough to work with for setup and breakdown, and to see if it is visibly cloudy or soiled. The disinfectant that we use here is called Birex. There are a variety of hospital-grade disinfectants, but the one that we have selected here is called Birex, and you'll see that on the bottles at the sink. So he's going to look at the Birex bottle, and there's really not enough for him to complete it with, and if it were visibly cloudy or soiled, he would discard it. So he's going to discard this, and then he's going to fill the bottle to, do you remember from your reading, how many ounces of water? 32 ounces of water, and he's going to fill that out here right at the sink. So discard what's in there, fill the bottle, and fill the bottle all the way to the top, so any residual bubbles from the previous Birex solution are going to come out, and then he's going to fill it to the 32 ounce mark at the top of the bottle. See where he's pointing to? He's going to screw the cap on, make sure the bottle is not dripping. He'll dry it with a paper towel, and he will take it to Central Supply to find a Birex packet, 1/8 of an ounce pre-measured packet, and he's going to add the Birex to the water to avoid chemical splashback. So if you'll follow Mark to Central Supply.
What I need to make sure is just that to check the expiration date to make sure that it's current. So you're going to look on there, and it's usually printed here, and I'm good until December of 2013. So I'm good with this one. I'm going to remove the cap. You have to look for the little perforation on here and tear. And then the solution is just in the 1/2. You're going to just hold it closely over the bottle. Squeeze.
And 1/8 of an ounce is not a lot of Birex, but it's all that is needed in order to be effective. So you're really going to kind of compress or express that packet to make sure that you get all of that liquid into the water. And again, Birex into the water so that you're avoiding chemical splashback.
Just making sure I secured the cap, and then I'm just agitating it to get the solution mixed.
Wash them. So he's going to wash the utility gloves 2 20-second consecutive wash rinses again. Again, because he's been in Central Supply, working on the dirty side of Central Supply, correct? So he'll wash these gloves, and then he's going to proceed to sanitize and disinfect the Byrex bottle, because we're about to begin that unit preparation sequence, and it requires us to have a bottle that is safe enough for us to work with, right? Microorganisms will have been reduced to a safest possible level on that bottle. So after he washes the 220 consecutive wash rinses, he's wiping up the sink. He's going to open a gauze packet from the opposite end of where it is sealed. It's just much easier to open it from the opposite end. So he'll open up a gauze packet and he will begin the sanitization wipe of the Byrex bottle. The first wipe, sanitization, remember, is removing any surface dirt, dust, grime in order to allow the disinfection wipe to work. So see how he's opening from the unsealed end a piece of gauze, and he's going to express some Byrex out onto the gauze square, and not so much that it's dripping and puddling everywhere, just enough so that he has a little bit of saturation to that gauze square, and then he's going to begin at the top of the bottle and wipe from top to bottom all the way around, including the bottom of the bottle. Wiping the bottom, taking the paper towel and the gauze square, taking a new paper towel and putting the bottle down. And then he must wash his hands again to go between a sanitization wipe and a disinfection wipe. So the 220 consecutive wash rinse is going to occur, and then he's going to disinfect the bottle. The exact same procedure, wiping the bottle from the top to the bottom, including the bottom of the bottle. When he's done with that, he will spritz the sink and the cuspidor. The sink is where he's washing. The cuspidor is this bowl right over here next to the chair. They are two of the more highly contaminated areas at the unit, and you want to make sure that you're allowing the disinfectant to work on those while you're working through the unit preparation sequence. So he sanitized the bottle, put it on a new paper towel. He's discarded the paper towel that the bottle was on originally, the gauze square that he used. He's washed. He's now ready to disinfect the bottle. And then that bottle he will use to spritz the sink and the cuspidor, and then he will place it on the same paper towel as the gauze squares. So here's the disinfection wipe, your second gauze. He's going to add Byrex to it and wipe it down from top to bottom, including the bottom of the bottle. Okay, see how he's moving right around that? Then the bottom. He'll discard the gauze and the paper towel. He'll spritz the sink and inside the cuspidor. So see how just going around the lip rim of the top of the sink and allowing the disinfectant to flow. And the same thing with the cuspidor. Without touching it, he's just spritzing the inside of that cuspidor and allowing the disinfectant to flow. He's then going to take the bottle back to the paper towel and leave it there. Now he's going to turn the unit on. He's going to remove what we call the rheostat. That's the rheostat is on the chair. He'll place it gently on the floor using the cord. He'll discard the paper towel that it was sitting on, and he'll make sure that the unit is up as high as it can go in order to flush the water lines on the unit. And there are three. He's just removed the foot pedal from the bottom base of the chair to ensure that it is up to its highest extent. This is the air water syringe he's going to depress, and he's also going to depress the two buttons on the cuspidor and the drinking cup for how many minutes? Do you recall?
2.
2 minutes. Why do you feel that we want to depress these buttons for 2 minutes and express this water for 2 minutes?
It's been sitting in there.
Correct. It's stagnant. Stagnant water in there. So it's important to get the water with a heavy, what we call a bioburden, out of there. We don't want anything that has been sitting in there and is stagnant to go into the patient's oral cavity, correct? So the air water syringe must be depressed for 2 minutes. The cuspidor must be depressed, and the cup. And this is all happening simultaneously so that you're constantly watching the flow out of the cuspidor spigot and out of the cup spigot, because you'll press them and sometimes they will stop running right away, or they may run continuously for a bit of time. You want to keep an eye on that to ensure that they are running continuously for 2 minutes. In the cuspidor, right? He's been in the cuspidor. So another highly contaminated area. So you want to make sure that once you've depressed those buttons, the patient water cup, the cuspidor spigot, and the air water syringe, that you're going to wash your hands for those 220 consecutive wash rinses. And now he will be ready to begin unit preparation from the top of the unit down. So we work from top to bottom and near to away because we are trying to protect our patients, correct? We're trying to reduce levels of microorganisms at our unit to the safest possible level to treat our patients. We cannot sterilize a unit. So we sanitize it and we disinfect it so that it's safe for patient treatment. So Mark is going to get another 4x4 gauze square. He's going to put disinfectant on it, and he's going to begin with the light of the unit because it's the top, correct? It's the top and it's closest to the patient environment. So he'll begin with the front of the light, and he's going to make sure that he's not pooling or puddling disinfectant into the light. He's moving in one direction, top to bottom, doing the handles, the back of the light, the elbow joint on the back of the light, and he's moving up and away, the switch of the light, and now the arm of the light, and he'll move away from the patient. Can you see that? Long, continuous strokes. He's going to then continue onto the remainder of that light pole and work himself right to the ultrasonic unit here. All right, see, this is an ultrasonic that is sitting on the tray. He's going to wipe over the top of that ultrasonic unit, the tray that it sits on, underneath the tray. Can you see that? Strokes all along in a single direction away. And then he's going to wipe the cords of the ultrasonic to the base of what we call the evacuation box. Will be a top surface, and Mark will show it. This is the evacuation box right here. So cords will get wiped to the base of the evacuation box. We won't wipe what is more towards the floor until we do bases in a little bit. Then he's wiping the remainder of that bracket arm, of the light arm itself, and the knuckle where the joint sits on top of the evacuation box. And now he's going to move to the tray on the bracket arm here. So he'll do the silver tray, the top of it, the sides of it, and the bottom of it. And then he will do the skid pad, which is the rubber piece underneath it. And once he sees the long strokes away, he'll pick it up, he'll turn it over onto the back of the tray, hang onto it with his thumb, and wipe the bottom side of the skid pad. The top of the bracket tray all in one direction, and then he will replace the skid pad and the tray itself. He'll do the sides, the front when he gets there. So he's going to do the air water syringe and the bracket and receptacle where it sits. So watch out, one long swoop down the cord. These are considered tops because they dangle over the top of the patient. So the receptacle, the bracket arm, the cord itself, that one long action, swooping action, those are the slow speed hand pieces. And he'll do the other. And then he'll do the back of that bracket tray, the elbow joint behind it, and the long arms that bring it to the evacuation box. So there's the elbow, and again, everything away. See it moving away from the unit. So top to bottom and near to far. And now he'll complete this arm all the way down to the evacuation box, including that knuckle joint at the evacuation box. Long overlapping strokes, correct? Once he's done with that, he'll assess his gauze, make sure that it doesn't need more Birex. If it does, he'll add to it. If it looks soiled, he'll change it. All right, he'll obtain a new one. So if he needs more solution, he'll just add it. If it looks soiled, he'll obtain a new one. He's going to go to the patient chair, do the front of the headrest. He can do the back of the headrest. He's going to do the front where the patient sits, the back of the chair. The arms of the chair. He'll do below the arms of the chair and the back of the chair. Okay, so now the back of the chair. See it? Long motions, top to bottom. And then the yoke of the chair that sits below it, right here, and the lever that is attached to that. That is considered a top surface. Below that is a base. We'll do that later. Now, long sweeping motions over the top of the seat up to the plastic, but not including it. See those long sweeping motions? Now he'll do the plastic, and then he'll discard the gauze. Why? What goes on the plastic? Patient's feet, right. So he's going to, it's soiled, he's going to discard it, and he's going to obtain a new gauze square and begin with the operator's stools. All right, so we've done what is most attached to the patient, what they're sitting in, where we're going to put their instruments, and now we're going to move out to the operator's stools, and we're going to begin again top to bottom with the back of the chair, see the top of the back of it? So he'll do the inside of it, the outside of it, including that metal backing, that's it, over the top of the chair, around the sides of it, that metal pole, and all, there's a lever there, and then both levers here, top and bottom. He'll do this stool, and he'll also do the assistant stool on the other side. You want to make sure that there are two stools at your unit, and that one of them is an operator stool, and the operator stool looks like the one that Mark did first. This is an assistant chair. Again, top of it is being done, the seat is being done, and any levers that you will touch with your hand during patient treatment. You do the top of them and the bottom of them. Now he's ready to move outward to his cabinets to the highest surface, and the highest surface here is the tower. When you're standing in front of a unit, you own everything to the right of the unit. So sometimes people share sinks, share towers, etc. But he's going to go across the top of this tower, down the front of the tower, and he's going to continue moving right down into the inside of the tower, wiping the inside compartment as well as any bottle that is sitting there from top to bottom. So he's going to do his sink area now. So the tower's been done in the front and the top. He's going to do the inside of that tower and all bottles that are sitting there. Once he completes that, he'll move forward on the cabinetry towards the sink. And then he'll complete the spigot on the sink, the spout for soap, and then the top of the sink area. So he's moving forward on the cabinetry to the spigots for water and for soap, and then the top of the stainless on the sink. And then he's going to discard that gauze and do what? Wash, because he's been at the sink. Does that make sense to you? So he's going to wash because he's been at the sink. So once he completes his 220 consecutive wash rinses, he's now ready to complete that tower. And he'll do the side of the tower, the back of the tower, he'll do the countertop that is next to him and all of the cabinetry on that area, and then he'll proceed to the cabinetry on this side. So you own everything to the right and everything inside. If there was another unit over here, the person on the other unit would be doing the top of this cabinet. But there isn't, so he has to do both sides. So he's ready now, new gauze. He'll do the side of the tower, the back of the tower. And then he's going to work around the computer monitor. He's not going to wipe it, and he's not going to touch it. He's just going to work around it. So side of the tower, long sweeping strokes, back of the tower. And then with strokes that he's moving away from him, he's going to begin the top of that tower, being very cautious not to jar that computer monitor. So as he gets past that, long sweeping strokes, and then what he's going to do is obtain a new paper towel, place it on the counter, and put the gauze and the Birex on that and discard the original paper towel because it's been sitting on a surface that was contaminated. So he wants a clean paper towel, and he's going to continue to sanitize the remainder of that top of that cabinetry. He will then move to the front of the cabinet, and long strokes, top to bottom, he'll wipe the outside of those drawers, keeping them closed. All right, he'll work to keep them closed. He'll then wipe top to bottom on the outside of the drawers, and then he will open the drawers and clean out the inside of the drawer as well. Wipe the inside of the drawer. The top drawer contains a keyboard and a mouse. You're not going to do that drawer. You're going to do the third and the fifth drawer there. Okay, so he's wiping inside, long strokes. He'll move to the bottom drawer, wipe that one on the inside. And then once he's done there, he will continue with the sink cabinetry, ending on that side by wiping all of the cabinetry in front of the sink. So drawers are completed there, and now the doors. Ending with those cabinets on the front face of the cabinet under the sink. That's it. And then he's going to move to this side, because he does not have anyone over on the other side to do the top, but he would own all of this inside cabinetry and drawer anyway. So he'll do the top of it, the backsplash of it, and then he'll also do the top surface of it, and then he'll continue with the sides, the front. On this, all drawers open. He's just lucky. He's got a unit that has it all. Okay, so he's doing the drawers, and then once he gets through with the outside, he'll move to the inside. And on this side, there are no keyboards or there's no mouse. It's only going to be on the side where you see the monitor. So each drawer will get done outside, and then the inside will be done. The sides of the inside and the base of the drawer. Once he finishes that, he goes to the base of the drawers and to the end cap here on the side of the cabinet. And then he's getting very excited because he knows he's almost done with top surfaces.
I'm perspiring.
Right. I'm perspiring watching him. So the cabinets and then the side. So he'll assess his gauze again, determine if it's soiled or if he needs more Birex. If it's soiled, he'll get a new gauze. If he needs more Birex, he'll obtain that. And then he's going to complete the last top surfaces. And they are done in a very specific sequence to decrease the amount of cross-contamination at the unit. So he's moving now to the last top surfaces. Begins with the evacuation box. He's going to complete the top of that box, the front of it, the sides of it, and the back of it, also including in that the arm that attaches that evacuation box to the chair, okay, to the patient chair. Then he's going to come over and do the bracket arm that holds the high and the slow speed evacuation, and he's going to wipe the hoses 6 inches down only right now for a top surface, and the receptacle and the arm itself. So both the high speed and the slow speed only 6 inches down considered for top surface. Then he's going to wipe the outside of the cuspidor top to bottom. He'll wipe the spigot where the water cup sits and over the top of that, so around the cuspidor. Okay, the spigot where the cup sits, across where the cup sits, the buttons, the spigot for the cuspidor, and then into the interior of the cuspidor, wiping around it, picking up the trap that is inside it, wiping the trap, and wiping the receptacle in which it sits. When he's done with that, what do you want him to do? Discard that gauze and wash, because he is in a very highly contaminated area. That concludes the top surface of sanitization base, so that nothing is being dragged from the floor up towards the patient's hand. So his first base will be to come 6 inches down on the high and the slow speed evacuation and wipe those cords, sanitization wipe, toward the unit. Those are the only ones that get wiped in that direction for a base. See how he's kind of putting pressure on those cords to hold them down? If you don't, they're going to pop out of the receptacles as you're wiping them, and you're going to have to start over. Okay? So the hoses are getting done, and then he's going to move to the next highest surface, which is the cream colored base below the patient chair. So he's going to do the top of it, the sides of it, the front of it, the back of it, and then he will do the cream portion in front of the unit as well, and then the brown base that sits on the floor. So he's got that cream colored portion done, now he's moving to this piece, and then once that is done, he'll begin with the brown base that is sitting directly on the floor. Long sweeping motions, and as he comes across the back, when he gets to the foot pedal, he'll do the cord and the top of the foot pedal. He'll complete the base on this side. He'll do the cord to the rheostat and out to the top of the rheostat. And then he'll begin with any other cords that are moving out and away from him toward the front of the unit. He can move to the cords that are remaining on the ultrasonic unit here. Remember, we only did those as a top down to the bottom of the evacuation box, so now he's completing those. And the foot pedals and all where they are sitting on the floor. He would also do the umbilical cord. That's that large cord he's wiping right now. He would do the electrical cord from the unit to the utility box, the top of the utility box, the sides of the utility box, and the front of the utility box. And then he'll do the base of the stools, everything that was not done with the top. So he'll do those bottom rungs and the casters and the feet themselves, so that each stool gets done, the base of each stool is being completed. So, and that would be the end of the bases. Once he completes the second stool, bases are complete. So you see bases move along much more rapidly than tops, correct? Once he finishes with the base, what do you want him to do? Wash, because he must go back to the top of the unit for the second wipe, or the disinfection wipe, correct? We've only sanitized the unit now. We got off the surface dirt and grime and dust, so that now we can allow that disinfection wipe to actually do what it's intended to do and disinfect the unit. So he would begin all over again and do the tops, wash, and do the bases. He's not going to do that today. We're going to just show you what that sanitization wipe looks like, but you would then know that you have to do that disinfection wipe in order to have the unit be effective for patient treatment. Questions on that at this point? Yes.